Oh, hello. Assalamualaikum and very good morning to all people. Today, I will discuss about teen suicide. Based on the Ministry of Health statistic, every one of 10 teenagers will involve in this case. It is happen because this teenager involved will feel depressed and anxiety. So it is so dangerous in our country. Without wasting our time, we I want to call my friend to discuss this topic using application Discord. So let's check it out.
Hello, Assalamualaikum and very good morning to our people. Okay, in the house we have Mr. Kamarul, which is UPM student. Okay, Mr. Kamarul, can you tell us about teen suicide?
Okay, thank you, Mr. Daniel. So about teen suicide, I think it is a very dangerous thing happening in our country because teen is the future of our country. So if this problem is being too many, is a really bad problem.
Oh, can you okay? If this happen in our country, what can we do to prevent this thing happen in our country? Because for me, this case is very dangerous, right? Can you
Yes,
explain?
it is. Yeah, I think it is a very dangerous case and very dangerous problem. So I think one of the way that we can do to prevent teen suicide is we need to be more caring to our surrounding, because these teens that being suicidal, they did not want people to know that they are suicidal. So as a caring person, we should ask them, are you okay? Do you have any problem? Do you need me to help you with anything? So other thing that we can do is to spread awareness about teen suicide, because we should make them know that they are not alone and they have somebody that can hear their problem.
Okay. Okay. We have running time. So see you later, Mr. Karul. Good luck for your running. Okay, thank you.
Assalamualaikum warahmatullahi wabarakatuh and a very good morning. I am Syahira Uda, the reporters from EAC 2013. Today I would like to interview a psychology student from Universiti Kebangsaan Malaysia, Najwa Fahana binti Syukri, about teen suicide. Okay, a very good morning, Miss Najwa. Good morning. Good morning. So let me see here. As we know, teen suicide is most related about teenagers that have depression. So Miss Najwa, can you explain more about this issue?
Teen years are the most stressful time. They are filled with major changes. Body changes, changes in thoughts, and changes in feelings. Some factors that can lead to teen suicide are stress, confusion, fear, and doubt. He or she may also feel a pressure to succeed. For some teens, normal developmental changes can be very unsettling when combined with other events such as changes in their families, siblings moving out, and changes in friendship. The worst part of this is when the teenager is in a relationship. For some, suicide may seem like a solution.
So which teenager are risk for suicide?
A teen risk for suicide varies with age, gender, cultural, and social influences. Risk factors may change over time. There are impulsive behaviors or family history of mental problems.
So now we know a little bit about the problem they face until something like this happen. So how do we deal with this kind of problems?
Treatment will depend on their symptoms, age, and general health. This treatment may include individual therapy, family therapy, and self-reflect about ourselves, because only we know how we want to face all these things.
These are the responses from my English and Counselor Matriculation Lecturer in Google Form. So now we have two lecturer here, Puan Rohaida Syari and Sir Muhammad Faizal bin Muhammad Isa. So this is Puan Rohaida responses. So what do you think about teen suicide? It can be prevented. What is the cause of this teen suicide? Depression, stressful life event, parent-child conflict, lack of parental support, family history, or suicidal behavior, and peer pressure, just to list a few. So how do you think to solve this kind of problem? Puan Rohaida said, proper counseling. So let we see Sir Muhammad Faizal bin Muhammad Isa responses. So what do you think about teen suicide, self-injuries by teenager? What is the cause of this teen suicide? Low self-esteem, depression or trauma, family history or suicide, low self-esteem, and other example. How do you think to solve this kind of problem? So Sir Faizal said, don't let your teenagers' depression or anxiety snowball. Listen to them, seek professional help, encourage your teen not isolate himself or herself from family and friends. And lastly, share your feelings.
Hello and hi to everyone. Today I will interview one city as parent to talk about teen suicide and give some opinion. Today we will talk about teen suicide with one city as our guest. Hello one city, how are you? Hello, fine, thank you. Okay. I don't want to waste time, so I have some question to you. Can you give me opinion about teen suicide?
Okay, as a parent to my children, I think that teen suicide is the bad behavior because it carries the person. This issue is very sensitive and sometimes happen to our family, and we do not realize about that.
Yes, I agree with what you say. Okay, let's continue with next question. So, as parent, what causes that? What do you think can make this issue in suicide happen?
Okay, these issues can happen with young people with mental health problems such as anxiety, depression, bipolar disorder, or insomnia are at higher risk for suicidal thoughts. This going of major life change, for example, parent divorce, moving, a parent's leaving home, or parental separation, and those who are bullied are at greater risk of suicidal thoughts.
I agree with your statement. So, thank you to One City because spend time in this interview, give opinion and explanation to these issues. So, I also agree because I hope that issue do not happen to others and we can live in a happy environment. So, thank you again to One City, and I hope that next time we can invite you again as a guest to our interview.